We just invented a new drug by the name of Nevlene, and it's to treat something I'll tell you about later. How much do you know your pharmaceutical drugs? Well, joining us this morning for 10 Minutes to Your Health is Tyrone Smith, Executive Member of Pharmaceutical Society of Jamaica. Good morning, Mr. Smith.
Good morning.
Morning, Tyrone.
Morning, sir.
Neville asked a good question as soon as you came out. Aren't we as patients supposed to just trust the doctor when we get a prescription and just head to the pharmacist and they give it to us and we take it?
In an ideal situation, that's how it's supposed to be. The truth about it is that sometimes there are issues with your prescription, and that's where the pharmacist comes in, because we would have to review those prescriptions and ensure that the authenticity of the prescription needs to be checked. We need to ensure that the prescription is for you, because the truth is there are times anything could happen, and we have to ensure that we're giving the right medication to the right person in the right doses. Yeah? So the pharmacist's job is to really ensure that for patient safety.
Okay, but why would we need to second guess what we might get on a prescription? If we as I said, we get a prescription from the doctor and I take it to the pharmacist, why do I need to know the drug? Why do I need to know anything about it? Shouldn't I just take the tablet as you give it to me?
Okay, so that's an interesting concern. One of the things that we need to consider, though, is that when you go to a doctor's office or into the hospital, as a matter of fact, the doctors take what is called a patient history. Now, depending on how detailed that patient history is, then the doctor will use that now to formulate his judgment as to how the prescribing goes. Now, imagine if you go to a doctor and you had ailments that you did not mention to the doctor, and the doctor proceed now to prescribe. Now, there are certain medication that might interact with medication that you're already taking. There are certain medication that may interact with a disease condition that you have that you may not have mentioned to your doctor. So the truth is, it's like you're doing checks after checks to ensure patient safety. When you come to the pharmacy, we review the prescription. Sometimes we ask you a few questions based on what we see on the prescription. There are things that has to be on a prescription, like the age. We want the weight of the patient, and because some medication doses are worked out based on concentration. So all of these factors are important.
I accept all of that, but you have not said, in my opinion, the reason I should know. You said why the pharmacists must know what's going on. So what should I know? So I'm taking a medication for a headache. I'm taking a medication because I get a cut on my hand, so I'm taking 2 or 3 of them. What should I know about that?
All right, so for the patient, what we want the patient to know in particular is, first of all, you need to know the name of your medication. You need to know the reason why you're taking a particular medication. You need to know what to expect from your medication. So in other words, you're given a medication, say, for a headache. Now you want to know that, okay, this will in fact relieve your headache and the symptoms that you're having.
But wouldn't the doctor tell me that before? I mean, him said, I'm giving you this because you have a headache, take it 3 times a day. Headache supposed to go away in a 2 day or a 3 day. Wouldn't the doctor tell me that?
The doctor will tell you that, and the doctor should tell you that, in fact. But let us say we have variability between patient and patient. So when a doctor selects a particular medication, and the intended purpose is that this particular medication that he selects among maybe multiple medications that are available for the same indication, the doctor is intending to cure you of your ailment. Now, you may take the medication, you may not get the sort of relief that you're expecting, right? So you need to know whether it is that you continue taking the medication, if you need to stop, if you need to contact the doctor, if you need to speak back to your pharmacist. So it's important to know what it is that you're taking.
So you're saying that we must go and do our own research even after the doctor has prescribed something?
It's always recommended that you ensure that you get as much knowledge as you can about your medication.
I guess if you read up on it and I'm taking something, it will tell you the side effects and what might happen to you. Is that on the label of the drug that I get, or if I ask you, or will the doctor tell me, or what do I do to find out those things?
Okay, so there is a part of the practice of the pharmacist is to ensure that patient is educated, counseled. You're not just telling a patient how to take the medication, but you also tell the patient what to expect from each medication.
So the doctor won't say that?
The doctors does it, but the point is, at the point of actually collecting this medication, the job of the pharmacist also is to ensure that you understand.
How often does that happen?
Well, it is supposed to happen every time you go to a pharmacy. It is supposed
Because
to happen.
I'm sure I've seen many incidents where people collect medication, you sit down, you wait, you pick up your medication, and then you just go. Is it required by law that they're supposed to tell us, or is it just out of the kindness of your heart that you're telling us? So how often does that happen, or is it supposed to?
All right, it is supposed to happen. It's not about out of the kindness of your heart. The truth is, for good practice and best practice, we need to ensure that patients are being educated, are being made aware of their medication.
Well, I do have an issue
and
with
what
that.
to expect.
I do have an issue with that, and I think you can't have too much information. But aren't you second guessing the doctor here? I mean, aren't you saying, boy, just in case the doctor forget? Are you supposed to second guess the doctor?
Well, put it this way: in healthcare, there are several different persons that work in healthcare. The doctor is one person that works in the healthcare. The nurse is physiotherapist, the pharmacist is another person that works in healthcare. And it makes up a healthcare team. So we don't want any one person in the healthcare team to think that, okay, everything begins and ends with them. What you find is that the pharmacist is a trained professional that looks at medication. That's an area of specialty for the pharmacist.
The doctor does it?
The doctor looks at medication as it relates to the curing of the disease condition that he's treating. Now, what happens is that, and I said it before, there are times when, based on the history that is taken, if you do not tell the doctor exactly everything that is going on with you or other medication, there are persons that are drinking teas that are herbal. These things may interact with a medication that is being prescribed. Now, if you don't tell the doctor that you're doing this, then you can see where potential problem lies. The pharmacist now is the one that will touch base and bring everything together to ensure that, okay, the medication is safe.
Again, I'm repeating myself, and you can't have too much information. But it almost sounds like you're saying just go straight to the pharmacist and nobody go to the doctor.
No, that's absolutely not what I'm saying. Well, you have to understand that the pharmacist is not actually trained in diagnosing the problem. Yeah, that's the doctor's.
Yeah.
That's the doctor's job.
All right. It makes sense. And as I said, you can't have too much information. So I appreciate that. Good to see you. And thanks for coming. Tyrone Smith, Executive Member of Pharmaceutical Society of Jamaica. 10 minutes to your health. We're doing again next Thursday. Soon come.